My name is Bo Pomahak. I'm a plastic surgeon here at Brigham and Women's Hospital in charge of the face transplantation program. This is a three-dimensional acrylic model of our patient and his defect. Following injury, he lost the bony structures of his midface that include the nose and the entire hard palate with all the overlying soft tissues, such as nose and upper lip. What we needed for the patient were tissues that included facial skin, the entire nasal structure, as well as upper lip and hard palate. Once we found the appropriate donor, the tissues were recovered, including muscles of facial animation and the nerves that power them, as well as nerves that provide sensation to the facial unit, and then brought it over to our recipient and reconnected the vessels under microscope. The donor needs to match not only from tissue characteristics, but also has to be age appropriate. We have found that donors up to 20 years younger or up to 10 years older are acceptable match, and similar color of skin. We've been struggling for years, perhaps decades, with the most difficult facial reconstructions and patients that needed extensive amounts of soft tissues, both for aesthetic as well as functional purposes. We have ultimately came to conclusion that the best reconstructive technique that would address most appropriately all of the issues would be transplantation of tissues that are alike compared to what the patient used to have. And those leads ultimately brought us to composite tissue transplantation being the answer to some of the needs that we had. The entire effort is truly multidisciplinary. We then formed a group of physicians that not only were able to participate actively in the procedure, had the adequate skills and knowledge, but also felt that it is an important scientific and clinical project. And once we were able to lay down the fundamentals of the project, then I approached the New England Organ Bank, and I think we got very fortunate that the leadership of the New England Organ Bank saw this as an important project and something that probably will be occurring more so in the future, and wanted to really take the lead on being pioneers among their peers.